We're excited to share with you today about how we engage with First Nations women with experiences of breast cancer through digital storytelling, and our follow-up study in which we're conducting a critical participatory scoping review of storytelling in Indigenous health research. We're very grateful for funding both from the Center for Healthcare Innovation and also CIHR, and would like to acknowledge our amazing team members, Dr. Donna Martin and Dr. Tom Hack. And we have many other co-investigators who joined us for the second project, and we'll introduce them when we get to that part of our presentation. So Dr. Marlon Bennett and I met when we were both PhD students at the University of Manitoba. She was in the social work program and I was in the nursing program. And we conducted this project about 3 years after we first met, when we were both new assistant professors at the University of Manitoba. Marlon, would you like to introduce yourself?
Thank you, Kendra. So I'm Marlon Bennett. I'm currently an assistant professor with the Master of Social Work based in Indigenous Knowledges program here at the University of Manitoba. I've been in this position for the last 6 years, and I will be joining the Faculty of Social Work and the Workland School of Education at the University of Calgary as of July 1st, 2022 as an associate professor. I will also be taking on a Canada Research Chair on Indigenous child well-being. So I'm pleased to be able to present alongside with Dr. Regier on this research.
Thanks, Marlon. It's just been such a delight to do this work together. And just to introduce myself, I'm an assistant professor now in the Trinity Western University School of Nursing here in BC, and very grateful to be a Michael Smith Health Research Scholar, and grateful also to live, work, and play on the traditional unceded territories of the Stalo people. So here's an overview of our presentation and what we're going to cover today. We're going to mostly be talking about two projects. And I think both of these are really great examples of how arts-based approaches can be used to engage patients in a culturally relevant way to understand health and illness experiences and to promote health equity. So a bit of background to our projects. We set out on this journey because Western research approaches often result in findings and policies which fail to address Indigenous priorities and healthcare needs. For example, in Manitoba, breast cancer mortality has increased for First Nations women, while it has decreased for all other women. And recent findings show that the life expectancy for all First Nations women and girls is 72 years. And this is lower than all other Manitobans by 11 years. So storytelling is increasingly being used as a research approach to understand Indigenous perspectives and health priorities. And there is a notable growing interest in digital storytelling, which is an arts-based method that involves creating a 3 to 5 minute video using multimedia materials to share a personal story. So in a research study, participants will often create their digital story in a 2 to 3 day workshop and then meet with the researcher after to talk about their experiences. The stories can also be used to share findings with patients, healthcare providers, and policymakers and academics in a really engaging way. So our research team was interested in conducting a research study to explore First Nations women's experiences of breast cancer with digital storytelling to inform healthcare services. And we viewed this project as occurring in 3 different phases. In phase 1, we wanted to engage with First Nations women to assess the feasibility and meaningfulness of using digital storytelling as a research method. And now we are conducting a critical participatory scoping review of storytelling in Indigenous health research. And these are the 2 projects we're going to share about today. Based on this work, we're going to co-create and implement a larger research study. So for the first phase, we applied for a patient engagement grant, which allowed us to develop our study plans alongside First Nations women who had experienced breast cancer, and enabled us to gain new research ideas and insights into their needs and priorities.
Our work was guided by a 2-eyed seeing perspective and a framework for our research engagement project. By valuing both Indigenous and Western ways of knowing, a 2-eyed seeing approach builds upon existing knowledge. Patient engagement and research can range from consultation to directing it, according to the SPORE patient engagement framework. This framework guided our efforts to engage with patient representatives on a collaborative level. So here are some of the questions that guided our workshop. So the objectives were to just explore Indigenous women's meanings around breast cancer, identify factors shaping health-seeking behavior, and whether those proposed methods are culturally safe, as well as explore the feasibility and acceptability of the proposed approach to doing this work with Indigenous women. And here you'll see this is our agenda for the day, our collaborative strategies to engage with our patient partners. And the first phase included, holding this 2-day digital storytelling workshop. It was facilitated by myself and Dr. Regier. There were 3 talking circles throughout the digital storytelling workshop. We discussed women's experiences with breast cancer. We heard their perceptions about what knowledge needs to be developed to improve services, and to elicit their feedback on the workshop. So to plan our workshop, we offered tobacco, we received guidance from an elder, we also consulted with leaders in the Indigenous research community. And we also made connections through Cancer Care Manitoba and the University of Manitoba in recruiting 3 Indigenous women who had experiences with breast cancer. And we held our workshop in June of 2019, and we incorporated the format of digital storytelling, but we also included, as I said earlier, offering tobacco to the participants, smudging, 3 talking circles, and a feast. And we also offered honorariums to thank our participants for their time, and transportation costs were also taken care of as well. And this is a photo of Kendra and myself at our workshop. And it just basically included a really good mix of people that were sharing, and there was a focus on their stories. And in this slide, we are showing examples of some of the questions that we asked during the 3 talking circles. These questions were reviewed by all members of our research team, our elder, and our Indigenous scholar. And so, for instance, the questions focused on how they coped and healed through their experiences, about when screening for breast cancer is not culturally safe, and what their thoughts were about the digital storytelling workshop. And this slide shows a picture of the William Norris Center, which is a satellite campus for the University of Manitoba in the inner city section of Winnipeg. This is the inner city social work program, and the facility has a round sacred room, which we were able to use for our smudging. And our meals were catered by the Feast Bistro, which is an Indigenous owned and operated restaurant here in Winnipeg that serves dishes rooted in the First Nations cuisine. And this slide here, we use the medicine wheel. This basically helped us to attend to the intellectual, the spiritual, physical, and the emotional aspects of this research. So you can see with the intellectual, we looked at oral storytelling. For the spiritual aspects of life, we incorporated prayers, tobacco, smudging. And to attend to the physical, we looked at food and feast, the location, and we gifted a painted rock to participants. And lastly, to attend to the emotional, we had emotional support in sharing circles. There was the creative process, and of course, using the expressive arts as a way to express knowledge. And lastly, we found that digital storytelling workshop facilitated a Debwewin journey. This is an ancient Anishinaabe way of knowing. There are 2 circles of knowledge. There is a circle of the heart and the circle of the mind, and knowledge is located in connecting both of them. And we have a quote here from an Anishinaabe elder that basically says, the longest journey is the one between your heart and your head. And finding one's Debwewin enables one to speak from the heart, which if often lacking in, well, it's often lacking in patient engagement initiatives. And really, Debwewin is really an Anishinaabe word for truth.
So our conversations with these women were very profound, and they provided deep insights into their experiences with breast cancer, and also provided critical feedback about using digital storytelling as a research method. And they really encouraged us that this method was very meaningful to them and encouraged us to move forward with our plans. And so based on their feedback, we embarked on a research project in which the patient representatives have become full research team members. So for phase 2, I'm co-leading this project with one of our patients from our digital storytelling workshop, and Dr. Bennett's a co-investigator on this project as well. And our project is funded by a CIHR Catalyst Grant in patient-oriented research. And our team brings together 21 amazing people and includes Indigenous and non-Indigenous researchers and Indigenous patients, elders, healthcare professionals, and administrators. And as you can see, their names are listed there on the left-hand side. We'd also like to acknowledge our elders who provide wonderful guidance for this work, and that's Elder Mabel Horton and Elder Sherry Copenase. And so our purpose in this project is to identify and examine how storytelling has been used as a method in Indigenous health research on Turtle Island, Australia, Owatoria, and to do so in a relational way. We're critically reviewing all published research using storytelling in Indigenous health research to determine how has this approach actually been used. And we're also identifying exemplary practices and problematic omissions. Then together, we will imagine how could storytelling be used in the future, especially with teams that are made up of Indigenous and non-Indigenous people in health research. So our project has two intertwining approaches, and both are equally important. The first is a critical scoping review, which is outlined in our published protocol, but equally important is gathering together to hear teachings about storytelling from our elders and hearing our Indigenous team members' perspectives on the role of stories in research. So we bring these two threads together in our conversations about this work at quarterly relational gatherings. And at our fourth gathering, we held a lands-based gathering at beautiful Cedar Lake Ranch in Manitoba to hear perspectives on our analysis and discuss our KT strategies. Our conversations have really transformed our review processes. For example, one of the many ways our conversations have been transformative and guided our review is determining what data is actually important to collect or extract from our included articles. Based on our conversations, we've gathered data about things like the purpose of using storytelling, types of storytelling that have been used, relationships between participants, community members, and researchers. What was the research governance in the study? And did they use cultural protocols? So far, we've collected and analyzed data from 178 articles that include some type of storytelling in Indigenous health research, including digital storytelling, sharing circles, yarning, and arts-based approaches to storytelling. And we're just really introducing our findings today, and we're currently writing up our manuscripts and planning creative and culturally relevant KT initiatives to share fully about our findings. But as an example of one of our findings, one of the questions we are looking at is, why did researchers use storytelling as a method? And we're finding patterns about the benefits of using a culturally appropriate research method. We found that authors stated they used storytelling to interrupt dominant and colonial narratives, that storytelling centered Indigenous voices and experiences in an evocative, holistic way, that participants found storytelling to be cathartic and healing and was a satisfying research process, that storytelling offered a culturally relevant and respectful research method that could incorporate Indigenous protocol, that it was fostering and empowered the relationships within Indigenous communities, such as intergenerational learning from each other. And that really importantly, it was an emancipatory process that disrupted research hierarchies. And lastly, that it reclaims, preserves, and illuminates stories. So we look forward to sharing more about this work over the following year. And thank you for listening to our presentation today about our evolving projects. We have our contact information here if you'd like to reach out to us, and we're happy to answer any questions you might have.